did such great work on families.
Yeah.
And who is MG? We don't know.
MG? I don't see an MG.
At the bottom, I do.
Yeah, MG, RR, G, J, and KH.
Well, it's a public meeting, so.
It is a public meeting. So.
You're on mute.
The RR is me, the GJ is Jill,
Right.
and KH is Heather.
Yeah.
Right.
So I had a few updates for you guys, and I know Tony wanted to go in depth regarding next steps. Not really next steps, but just kind of taking the temperature of where we are and where we want to go moving forward. But we have such a lean team here today. I don't know if we could come up with a decision with so few of our members here.
Well, I don't think we're going to reach any strong conclusions, but I think it would be useful for us to begin to think about, you know, where we're going with this. So, and I suspect Jessica's going to get on the call because she did such good work this past week.
Definitely did. She definitely did. So, well, then let's just jump into what we have on the agenda thus far. I've already taken you guys' attendance. Thank you for being here. I wanted to provide an update on the prevention symposium. So as you guys know, we have a goal of having the symposium January 7th, 2022. We've been working towards finding a platform. That's our biggest hurdle in building this symposium. And so we reached out to OHSU to partner with us to be a co-sponsor of the event. Oh, there she is. All right. And here's Jessica coming in now. We reached out to OHSU about 3 weeks ago to see if they would be willing to be a partner. They are willing, but unfortunately relayed to us that their communications person is leaving. And so that person is the one who manages and troubleshoots for their video conferencing. So again, we're back at square one. They're willing, but they just don't have the resources to make it come to pass. So we were trying to do it on our own to see if we had a license that maybe, you know, we could find or what have you. And so we're in that process of seeing if we can find a license that we could use Zoom for government, because everyone I talk to does not believe Teams is a very good platform to hold the symposium. And so we're going to not use, but to do that, then, you know, we're going against what is, you know, what we use agency-wide, and we'll need an exception for that. For that reason, it's now looking as though we're going to have to postpone our symposium. We don't have a new date, but I don't anticipate it us waiting any longer than maybe February, March at the latest.
I have a Zoom account, but I would have to check on how many people could be on it. But we could probably work that out if that's useful to you.
Well, what we wanted to utilize is, it's called Zoom for Government.
Uh-huh.
And so that's the one we're going with, so a license.
I see. Oh, that makes good sense. Yeah.
Yeah.
I'd be anxious to see that.
Yes, that's the license we'll be using. We've also come up with the theme for the layout of the symposium, where we've decided on 4 panels. The first panel will be on research and prevention. The second panel will be on family intervention. The third will be on school interventions, and then the fourth on community intervention. And we'll wrap up the day by developing a vision for the future as it relates to prevention. I've identified with you guys' help quite a few panelists for each of the 4 panels, and we are drilling that list down now as we speak. We also learned that there's a listserv where there's a host of prevention specialists and prevention coordinator, county prevention coordinators that are already on this listserv. And so we're going to use that to advertise our symposium. I believe there's over 600 addresses in that listserv that it'll go out to once we're ready to disperse the save the date. So I know it's a lot of information. Any questions so far?
At some point, do you want this group to help with the panel on family interventions?
Well, you guys have helped in a number of the organizations, programs, Tony, that you've identified. They are part of the list. Just finding a point person to maybe speak about the program is where we are now.
Okay.
Yeah.
I think, and I mean, we have identified maybe 8 or 9 prevention researchers, and that's just the researchers. Somebody got to speak for all of them. We're not going to put all those people on the panel. And then we got to get somebody to speak for, I think OPEC clearly.
Yes, I agree. They're on the list.
Yeah. And then,
Well, Tony, let me just stop you for a second.
okay.
The researchers are all from University of Oregon, which,
Not all of them, but most of them.
well, maybe you could identify anyone that isn't from the University of Oregon.
Yeah.
Because the list I have, they all are identified with the University of Oregon.
Well, Carol Metzler is not, and Patty Chamberlain is at the Oregon Social Learning Center. But as I'm saying, you know, I don't, I'm not, I don't have a preference for who it is. I think somebody needs to speak for family interventions. The problem is that every one of them is going to say, well, mine's the best program, you know. So somehow we have to figure that out. Do you have thoughts about that?
I think that's, yes, I have thoughts about everything. I think that's the least of our problems at this particular point.
Okay.
I think I just want it not to be representative of one institution because, you know, like our friends at OHSU,
Yes.
They've got some great programs that we would want to hear from in their addiction medicines area as well. And we have relationships with some of the folks there. So I just would want to include them if they're available.
No, I agree. I mean, this has to have a feel of people coming together. I'm sorry, Tori, I got us off track.
That's okay. So yeah, just as we finalize the list, we'll be sure to share with you guys. But we definitely have incorporated your input, and I really do appreciate it because some of the people you suggested, you know, I didn't know of. So I appreciate your guys' help.
Can I ask a question? So, and I think it's the state of Washington. Maybe Tony, you've mentioned somebody who's doing good work there, or so on these panels, would we want to include someone from another state?
Yeah, well, Tori and I have discussed that. I think that Kevin Haggerty would be an excellent person to have probably on the, I mean, he'd fit in several places. He's a prevention researcher, but I think what we could use his input on the way in which the state of Washington has gone about integrating practice, prevention research, and the state's efforts but also the training. He has a grant from SAMHSA for Region 10, which includes Oregon, and that is focused on improving training for people.
Yep, I've sat in on several of his things.
Yeah. So I think he could also talk about what's going on in the state of Washington and the state of Alaska relevant to community intervention. So I think all around he could be very useful.
Okay.
Maybe you and I should talk about that 45 minutes. You know, we had talked about that this morning. Perhaps we might give him the end of the day to bring it together and talk about sort of the pathway that Washington used to get prevention in a much better shape than it is in Oregon. Yeah. Instead of just putting him on a panel, but give him that time to really talk about sort of how they did it.
I think it's a great idea.
That's an excellent idea.
Awesome idea.
Yeah.
Because what I read, that was what I was thinking. I'm like, Oregon may have all these great programs, but somehow we're not.
I think that's one of our biggest problems.
Yeah.
Right.
Instead of trying to recreate the wheel, maybe we could hear what Washington did, because our governments are very similar. Maybe there's some insights there that we could use.
I love that idea. Yeah, let's do that. Let's do that. Okay, good plan. Good plan. So, okay, I'm past my time. I've taken up enough of our time. That's an update. Again, as we know more, I will share with you guys. Next up, I wanted to review our assignments, if you would, for lack of a better word. We had some folks we're going to reach out to and connect with, and I just wanted to know from you guys how that was going. And I will start with you, Tony.
The dog ate my homework. Well, let's see. I've been in contact with a number of the family people, and in fact, some further contact with Beth Stormshack, and also with Lisa Scourin. But Jessica's going to talk about Lisa because she got the information from Liz Scourin. And I think we've been in contact with each of the family programs that we have identified in a list, which is looks something like this.
I had Steve Allen on that list, and I left a message at his office. But then I also went on LinkedIn and sent him a message directly, but I have not heard anything.
Okay. So I'm just going to flash this because Tori said this was in the minutes of the last meeting, but these are just the people we've identified who have a program. Oh, Holly Waldron has functional family therapy. Another person who is not at the University of Oregon, though she is in Eugene. So I think we've identified, but Jessica identified another program that's under development. And I think when Jessica talks, she'll talk about that. But I'm just saying we're in contact with sort of the key players and research on family interventions, all of whom are providing and have been providing services to people. And I think it's relevant to remind people that there are literally thousands of people in Oregon who have benefited from being in these studies. Mm-hmm. At the same time, I think what we're trying to move toward is making sure that every family who gets it gets it. So we need their help in getting clear on how much where they're reaching people and so on. So I'm not sure what else do you have me down for?
I could bring it up. Give me just a minute.
Let me close this. I don't know how to stop sharing. Oh, there we are. While you're doing that, I should also say that I've asked several of the family researchers if they're connected with OPEC, and they have so far said that they're not. I got that from Marian Forgotch's group and from Liz Scowen's group, and I think from one other group, which I think is an example of the kind of way in which we're not as coordinated as we might be. So.
Mhm, I agree.
So I just put something in the chat. Are anyone familiar with Capacity, which is Recovery Resource Hub, and it's for the country? There's a lot of information if you zoom in on our area, Oregon in general, or pick a city or whatever. Anyway, there's a lot of information on there.
I'll have to check it out. So here are the programs and the people assigned, and you went over and above. Definitely did your due diligence, Pam, and trying to reach Steve Allen, but unfortunately, it sounds like he hasn't returned your call yet or returned your email.
I'll keep trying. It's kind of gatekeeper stuff.
Yeah, and we've heard from Oregon Parent Education Collab. So Generation PMTO.
And I haven't heard from Jordan Robinson. He's on my list.
Okay.
He's one person who's could speak to a system that seems to be working very well in Yamhill County. By anybody who they've had a lot of home visitors with different issues they're helping families with, but they've got a system where if they identify a family that could use services, they have a meeting once a week to make sure that that family gets connected with the right service provider. So I think that's one model for how that can be done. I think he could be very helpful.
So has anybody been able to ask those 3 key questions of their organization? Has anybody gotten that far?
Yeah, I did. I posed the questions to Liz Scouron, Beth Storm Shack, and then through that process, Liz Scouron connected me with a new researcher, or a researcher that wasn't on our list, I should say, Maureen Zalewski Regnier, I think is how you pronounce it. And she is currently doing research on a dialectical behavior therapy skills group plus parent training. So that's still very much at the research stage. She said it's not rolling out, but families could be enrolled in the study and receive the service that way. But the materials I sent, hopefully everyone, I tried to make sure I had everybody on the email list this morning, are those researchers' responses to those questions.
Awesome. I did read a little bit. I spent my time reading about the DBT plus parent education. And I think it's specifically for parents in recovery. Did I read that correct?
I believe it's parents who have any kind of history with substance use disorder and who have high levels of emotion dysregulation. I'm not sure if they're actually requiring that they have a diagnosis of borderline personality disorder, which is what DBT was designed for originally, but has been broadened out to a wide array of emotion dysregulation related conditions, but definitely history of substance use disorder for the moms.
Awesome. Thank you. Awesome. So, Tony, have you been able to get any answers back of those 3 questions, or have you guys gotten that far?
I have asked those questions and I have not yet gotten answers.
Okay, so as it relates to, so there was some other programs you identified, Tony, during your presentation to the Salem Kaiser School District.
Yes.
And so I don't know if these would fall under family interventions, and if we wanted to take any of these on.
Yes,
Or-
I've not connected with the Nurse Family Partnership, but someone on, I think on one of our calls said that it is happening considerably in Oregon. But weren't we going to reach out to OHA about their family programs? Because I haven't heard. I think they might have the answer to that question.
I believe so. I believe we don't have a person assigned as of yet. So, but is Lori that contact person you're thinking of, OHA? From the Child and Family Behavioral Health Division?
I don't know. Dr. Richardson, did you have somebody at OHA you were going to contact? I know that Lori Theodorou, if that's how you pronounce her name, has been supporting the implementation of PMTO. And I believe they're training people in options counseling to do PMTO, but I don't know about other programs that OHA has an involvement in.
Yeah. I think I did get assigned to do that, and unfortunately, I didn't do anything about it. Yeah, sorry. That one I lost on my to-do list. So let me follow through. Just again, what was I supposed to do?
I think we want to know what OHA is doing relevant to the funding of family interventions. And I suppose questions would include, are you working with OPEC on this? We hear are you funding any of these programs? And the basic 4 questions. I'm sure you're going to find that they're doing it with, there's child abuse. They're all different subcategories of families with problems that they're probably working on.
Okay. Hey, Jill?
Yes.
I know that you've had contact with the children's unit. Do you have any information on this question?
No. And here, I'll go on camera so everybody can see me. No. The conversation that I've had with the Child and Family Behavioral Health Unit has really been around school-based interventions.
Okay.
And I have never talked to Lori Theodoro. So no, I don't know anything about family-based interventions that OHA may be helping to fund or support.
All right. Thank you. I just wanted to make sure. So I'll follow up this time again. And I'll get back to you guys.
Okay. Thank
And
you.
Tori, I'm sure we'll make sure I do it this time.
You get one dog ate my homework. Each person does.
And so do we want to assign someone to reach out to Lori? Or would she be absorbed within that, what Dr. Richardson will do?
I'm open either way. I'll take it on if nobody else wants to do it.
I mean, I'm happy to call, do whatever.
All right.
Okay.
I cede to the lady Pam Pierce.
Yep.
Good.
So next we're going to really quickly go through the others that hadn't been assigned. They were really my add-ons. And the answer could be, we don't want to follow it. But
I've already put Nurse Family Partnership and Oregon Academy of Pediatrics on my list. I had promised to do those previously, so.
And the pediatrics, okay.
Yeah. And Triple P, we've got that one, Carol Metzler. So I think you can take that off the list. And let's see, the other ones, I think this is a list of, gee, are these happening in Oregon? New Beginnings is a program that Erwin Sandler developed at Arizona State. And to my knowledge, it's not being delivered in Oregon. And I don't think Strong African American Families is either.
No, it's not. I researched Strong
Oh,
African
okay.
Families, and it is
Okay.
not provided here in Oregon.
Yeah. I suppose I'm pretty sure that that's also true of Strengthening Families. There was some of that work being done in Oregon, but I believe that was just funded for a year or two and then the money dried up. The EFFEKT, I don't believe is happening in Oregon. But the Families United, I think that that's what's his name? Somebody's. I missed something. I think that's the program that was developed at University of Miami by a guy whose name I can't recall. Though I should. But I don't think it's functioning in Oregon.
Okay.
And
I researched and I want to say I think there may be, but I'm not certain. They have a website where it's described, but I'm not certain if it's in Oregon or not.
Well, I know the guy whose name I can't recall, and I could contact him if I could remember his name and find out if it's happening. And then the functional family therapy actually is a program that has been implemented and is, I think, still being implemented in Oregon. And that's Holly Waldron at the Oregon Research Institute. And I have reached out to her and she has not responded, which is troubling to me because her husband is one of my closest friends and he hasn't responded either. They've moved to New Mexico, though they still work for ORI.
Everything is okay.
So are these programs that a few different organizations would use, or are these organizations that are doing prevention work?
Well, you know, most of the research-based family interventions that are in Oregon were developed when somebody wrote a proposal to National Institutes of Health. They got funded, and then they had to find the families to work with. And they might have done that through schools. They might have done that through clinics. I know Holly Waldron has worked specifically with adolescents with substance use problems. And the functional family therapy is a pretty well validated program, and she's done a bunch of research on it. But when you do that kind of research, you get, I need 100 subjects. I got 100 subjects. I did my randomized trial. I'm done. It doesn't mean that when you're done with that there's going to be an organization now providing that. And I think that it'd be fair to say that the researchers over the last 15 years have been dragged kicking and screaming into having to do research on not only does this work, but how do you get it to be widely adopted? And so this whole area of science called implementation science has grown up. I am not very impressed by the research that's being done on it, but it's a complicated problem. Now I got to show not only that I could get this working in a bunch of clinics where we train people, they're not researchers, but we train them to do it, but I also have to show that it worked when we did that. And so it's complicated. Probably the best work that's been done on it is Marian Forgach's work, where she took Parent Management Training Oregon, implemented it in Norway. She trained people in all seven regions of Norway. And then they trained other people. And then she did a randomized trial of the efficacy of the program in Norway when done by Norwegians who had been trained by people who she trained, and they got excellent results. She's got a system that's really tight in terms of making sure you're doing it exactly the right way. So
That's awesome. Okay, so thank you. I've updated our spreadsheet and I'll send it out to you guys in our meeting notes. So we'll know who's on first and what's done and what still needs to be done. Thank you. So now we can have our discussion about where does our work group go from here?
okay, so let me speak briefly about this and then turn it over to a discussion. I realized in looking at this agenda that I left one thing out, and it's highlighted here. But it just seemed to me that we're gathering a lot of information, we're seeming to come together around a number of things, and that ultimately we want some sort of document that's like, here's the state of family services in Oregon, and here are the strengths and weaknesses of it in some way described, and then what are we going to do? And so I started outlining, as I am inclined to do. And it seems to me that the first thing is a sort of public health vision of family services. And what I mean by that is, I mean, public health is simply what's the incidence and prevalence of a problem in the population. You know, most of the researchers have been very busy helping people with a problem, depression or anxiety or substance use or whatever. And we've gotten pretty good at saying, you got this problem, I can treat it. We're getting pretty good at preventing these things. But that doesn't in any way guarantee that the prevalence, the incidence and prevalence of these problems are going to decline in a population. And one of the ways you get them to decline is to make sure that every family who could benefit from a family intervention gets it. So that's the public health vision that we estimate the, oh, I was going to show this. I thought I was showing it. Oh, anyway.
I'm showing it.
Okay. Well, but you don't have my highlighted thing, but we'll get to
Oh,
that.
I don't.
I thought I shared it. Well, it doesn't matter. We'll work it through. But so we want to estimate the proportion of families that are at risk. We want to monitor the proportion of at-risk families who are receiving services. Are we doing better and better at reaching more? Are we implementing policies and procedures to steadily increase the reach and effectiveness of family services? That's basically, it seems to me that if, 5 years from now, well, let's say 20 years from now, they built a statute to our work group, it would be commemorating the fact that we gotten to the point where, 70–80% of the families who could need services are getting them, and fewer families need services because we are accumulating all of these people who are already functioning well and they and benefited from these kinds of programs. So the next point in this would be the efficacy of family interventions. It would just simply summarize that, hey, we have the knowledge to do this if we can reach the families. So that makes the reader hopefully say, yeah, we should have more of this. But then there's the third point, which I just added, which is description of the current state of family programs in Oregon. That's really what we've been working on. And I think we need a coherent description of what we've learned. I think we've learned about OPEC. We'll describe that. We've learned about all these programs. We'll describe them. Then we're going to get to number 4, which is that, gee, there's not as much coordination of this as there might be. And I think that needs to be informed also by what Jordan Robinson and all of the players tell us about what would be things that would strengthen this system. And so that's a lot of listening, and we organize that into some sort of description. And I think in the process, we try and get all these players to work together, because I think that if we play our cards right, at the end of the day, these groups will be working together more effectively. The researchers will be working with OPEC and with the state because it works for them to do that. They're getting better at implementing these things, and we're reaching more and more families with good outcomes. And so in the end, there's a set of recommendations, and there I want to talk, maybe we start with Dr. Richardson, because at some point we want to affect public policy in Oregon. And at that point, I want to turn it over to Dr. Richardson. So maybe we could just have some sort of discussion of this. I think we should hear from everybody. Reginald, would you be willing to start?
I'm sorry, Tony, I'm not following the question.
I think the question is, well, I guess it would just be your reaction to what I've just said and the notion of how this would culminate in a set of recommendations that are concrete recommendations that would have action implications for what the state of Oregon and the players involved in this would do to strengthen family services. Is that a reasonable question?
Yeah, I'm always interested in how do we get there?
Yeah.
So I guess what I would be most interested in, what are the elements of a effective family intervention program, and that we advocate those elements. Those elements should come from evidence-based programming or evidence-informed or programs that have evidence-informed emerging practices, what those elements are, and that we recommend in some type of statement about what those elements should be, so that communities have a sense of, here's what's already been tested, here's what the programs could look like, but these are elements that you must have if you're going to have an effective approach in a family intervention. Instead of naming specific programs that have been validated, what are those elements that programs who have yet participated in an RCT or will never participate in an RCT can at least start to adapt those elements of programming?
Well, one of the things that has been developing in this area of research in the last 10 years is an approach that I think is very much in line with what you're saying. And in fact, there are some people who've developed a system where somebody working with the family doesn't. Originally, these programs were developed, and so at first you do this, and on the second session you do this, and the third session, they were heavily scripted. But you might do one of those things with a family that doesn't really need it. So if you look at a program like the Family Checkup, and I think this is consistent with what Beth Stormshack was describing, you may not need much on one aspect, one element. So you don't use that element, you use the other elements. And so it's not only a question of what the elements are, but it's also a question of using the right element at the right time. I think that all of that will require training. I think that if you train someone in any of the family intervention programs that we're talking about, they pretty much have the same elements. Mark Van Ryzen's meta-analysis of family interventions that have been shown to reduce substance use found that all of the programs had a certain set of elements. Those are the elements I think that we would want in our recommendations. There were a couple, however, that also focused on talking to kids about their future and what their future might be like, and talking in a sort of visioning way. And that was something that wasn't an element in all the programs, and that seemed to add to the strength of it.
So I like that approach. I like what Dr. Richardson was saying about what are the elements of an effective family program. But in my mind, I would look past the programs themselves, because my definition of an effective family program is one that's known and utilized. And so for the family programs that are getting it right in regards to reaching a large number of families, we want to know what they did. Because in my mind, that's part of success, is having the program utilized by a large number.
Yes, yes.
families.
Well, and I think if you train people in any of the programs we've been talking about, they will have those elements. But at the same time, they probably need ongoing help with which elements to use in which circumstances. But yeah, I think we're moving in the right direction. So
I strongly think that if we can't recommend specific programs, because if the recommendation of specific programs worked, we would have that currently in Oregon. So what's the barrier for
yes,
for large segments of the population to adopt these programs? And what I think in part what they are is not only lack of knowledge, but it feels so complicated and overwhelming and expensive, right? If you read that a university-based researcher comes up with this program and here's what was their success, there are very few communities that have the expertise to deliver it. But if we're offering, here are those elements, and we know that there are certain elements put together are going to likely give you a better outcome than what you previously had. That seems like a better marketing. That seems like an easier thing to market than trying to market the entire program wholesale.
Well, I think I would say yes and no. There's even among just the researchers, there's been resistance to saying, well, this is a program everybody should adopt. And if you go to the legislature and say, we picked these 3 programs, you should fund them, there are going to be 6 other programs who are not very happy about that. And so that, I agree with you, that won't work. At the same time, we need to have a training program where people are learning how to, not only what the elements are, but how to make them work. And so I understand that you don't want to be in a position of saying, these researchers have said you got to do this and you got to do that. That's not persuasive. But I think that we would have to strengthen the system for training people, which is, I think, what OPEC is trying to do. I think they would agree with you on your strategy. It would be useful to have that conversation with these players, and I would like to invite the researchers and OPEC to possibly meet with us and discuss this.
Mm.
So what are your thoughts about any of that?
Jessica has her hand up.
I'm sorry, I didn't understand.
Jessica has her hand up.
Oh, good.
Yeah, I just wanted to chime in that, and this was somewhat captured in the email I sent, that sometimes focusing on the elements doesn't translate well because it is the constellation of elements, which is kind of getting at what you were saying, Tony, right? Like if we focus on just this one, kernel, if you will, or a part of an intervention that works with young adults, which is challenging normative misperceptions of alcohol use, when you deliver that through a sort of broad mass marketing scheme, it doesn't work very well. When
Right.
you do it in person, in groups, it works a little bit better, but it works the best when you tailor it to each individual. And so I do think there is somewhat of a danger of us presenting purely sort of a principle-based, like if you include these elements, it's going to work, because that's not necessarily supported by the science. But likewise, completely agree with what you're saying, Dr. Richardson, about how there is sort of a very poor connection between the interventions as designed by researchers and their implementation in the community. And it's often set up as being overly complex. And so how we might make it less complex or increase or decrease the barriers to implementation could be another approach.
Right.
Mm-hmm. Mm-hmm.
Yeah, I think the family checkup is pretty much organized along the lines of what you're talking about. And it doesn't expose every family to everything because they don't need certain things, which is how they can do it more efficiently.
Mhm.
So come back to well, let me ask this question, and then I'd like to just use my pack sticks and have everybody talk. Does it make sense for us to start thinking about what a document would look like that would be essentially a report back to the prevention subcommittee and ultimately to the commission along the lines of what I've outlined? How about if I call on Pam first?
There's so much. I like the idea of a document because where information gets uploaded, because it starts to make sense, and because there's so much information.
Mhm.
I just recently sat in the National Council for Mental Well-Being. It was a webinar titled Getting Candid, Framing the Conversation Around Youth Substance Use Prevention.
Mhm.
And that keeps popping into my head as you're talking, because again, it's how do you get it from what the program, how do you bridge that? How do you get that message? Because everyone has said this. Not every family needs all of this stuff.
Right.
Mhm.
I think the example Jessica gave is, you're trying to establish that norm. And if you try to start with that with a family where there's a lot of conflict, it would probably backfire.
Yes.
Dad said I shouldn't use these drugs. Guess what? So.
Yep.
So the other, the other thing that the risk that I am seeing is right now, even with the smaller assignment of the 3 questions, our engagement level is fairly low. And so to add more to that without having had the first iteration fully done, I don't know if we're setting ourselves up for frustration. I feel like we need to build the rapport with our contacts to start with the smaller, easier questions before we progress into more in-depth ones. Just a thought.
And can I also throw this out? Going back to Kevin,
Mm-hmm.
what about posing what we're talking about to him? Just as a kind of bridging the gap. Just like Dr. Richardson said, it would be great to have him at the end. He will have listened, and it's like, tell us how Washington got to where you are. It's not, they're not perfect, but it's like, how'd you do it?
Yeah, definitely.
And maybe that's a conversation with him before the
to set him up for that discussion. Yeah.
Yeah, and Tony, and again, maybe sharing with him this information and kind of, what our hope is. And he may say, you're on the right track, do X, Y, and Z, or back up, you're not thinking X, Y, Z.
Right. Good point.
I'm going to make a prediction, and we'll see whether or not my prediction will come true. The biggest difference between Oregon and Washington, or Oregon and Colorado, where I think they also do prevention fairly well, is the source of funding, how it's funded. That there is an entity that is responsible for prevention, and it's funded. And then that entity then funds prevention out into the communities. That's what I think is the biggest difference. But we'll see. I could be wrong.
Has Oregon ever had it?
Well,
I haven't been here very long, so I don't know.
When people talk about the breakup of the county system, I think that's an example. That's kind of what they're talking about. There was an authority on substance use prevention, addiction and mental health services, and they moved that into OHA, but they lost the infrastructure at the county level. Now, one of the reasons we're having this meeting is because we're trying to bring these people back together and trying, though not rehashing the
Right.
the anger about it. But
I don't want to feel bad. Like,
yeah,
it's just like we're moving on. It's just everyone stay present, and we're just going to keep moving forward. Whatever, the past is the past.
So we have, something to mull over and to consider and think about further. I think, and we meet every 2 weeks, so we'll be able to meet pretty timely to have further discussion about this.
Well, I made a note that I will take Reggie's observation or his prediction. I'm going to take that question to Kevin and see what he says. But I do think that if a state were seriously, interested in comprehensive prevention, they'd have a prevention entity. And I mean, I think one of the things we'll find out, not just with the family programs, but in general, OHA has, in our last prevention committee meeting, somebody rattled off, there was this siloed funding stream and that siloed funding stream and that silent funding stream, and which, by the way, none of them mentioned family interventions. So we need to
Bring it together.
Yeah, the other thing I think we need to do is we need to look at how we can sell this to the citizens of Oregon. We need a document, but we also need a website. We need social media, and we can do that.
Definitely.
But first, we got to get clear on what our message is.
Definitely. So I've updated, we're at the end of our meeting, I've updated our spreadsheet. I'll share it with you guys as well as meeting notes in the next few moments. I'd say, again, continue with the big 3 questions with your assigned folks as best you can. Try to build those rapport so that if we do decide to dive deeper, we have that relationship where they will hopefully, answer us a little more timely.
And would you be comfortable with our organizing a meeting of the family interventionists and OPEC?
I'm okay with that. Do you need our participation or our support? But yeah, I think that's awesome.
Well, yeah, I think we'd invite them to one of our meetings. And
definitely.
just make the meeting about.
Okay. Yeah, let's do that.
Getting organized.
I'm okay with that.
And right. Tony, is one of our to-dos you getting in touch with Kevin and sharing him all this stuff?
Yes, I will do
I'll add that. I've added that. Okay, so I'll get some between Heather and I, we'll get some really good meeting notes out so you guys have a roadmap of what to do next. Okay.
Hey,
thank you for participating.
Process check. How is this meeting for everybody?
I mean, I appreciate it because I don't know, it's chipping away at it.
Dr. Richardson.
Yeah. I think you should provide coffee.
I'll do my best. Actually, someday in the future, when we're unveiling the statue they built to us, we'll be able to meet in person. Tori.
It was a good movie. I'm a good meeting. I agree with Pam. I feel like we're chipping away at it. I'm feeling good about this.
Jessica, who gets the award for the most information gathered this week.
I concur with Pam and Tori that, yeah, I feel like we're making incremental progress, which is all that you can hope for is forward momentum. So we will get there. Jill.
Agreed with everything everybody's already said, including Dr. Richardson's comment about coffee. I highly, Dr. Richardson, a thumbs up on that one.
We'll see what we can do. Send me your addresses.
And we have Heather, your feedback.
in January, the state will be open
Mhm.
and the governor's order for in-person meetings will change. So there may be some opportunity to do a hybrid because many of you are in different parts of our state. Eugene and Pam, you're up towards Portland way. So maybe there'll be some opportunity for us to be face-to-face one day.
Very good. Well, good meeting.
Thank you again, guys.
You guys are
Have
great.
a great day.
You
Thank you,
too.
Dr.